On Saturday night, Marcus Smart of the Boston Celtics was taken out with a left calf injury. This injury was extremely suspicious for an Achilles tendon rupture. Let's talk about this in more detail and discuss some updates. For those who don't know me, my name is Sonam, and I'm a resident doctor specializing in sports and exercise medicine. On this channel, I review injuries as they happen so that an average fan can better understand them. Please like and subscribe my channel if you want to stay up to date on the latest content. For now, let's get back to talking about Smart's latest injury. So immediately after the injury, up here I'm going to put up a tweet. The Celtics team pretty much said that he likely had a left calf strain. However, when we look at the replay footage, you'll see that I'm quite concerned of an Achilles tendon rupture. Then, not too long ago, we actually received an update from Sherania, and I'll put the tweet up here, which says that Marcus only escaped with a grade 1 calf sprain. Now, to really recap, this is the best case scenario for him, and he won't be out for very long. But let's actually go over the footage and discuss what we're thinking on a play-by-play basis. So this is the play that Marcus injured his left calf. I want you to keep an eye on his left calf here. So he's jumping. Usually we're worried about Achilles tendon, calf issues, especially when players either explode up or land from an explosive jump, because it puts the greatest tension on the Achilles tendon. And I'll show you that a bit later. So huge jump, seemed like he tolerated it okay. So now I'm looking at the landing. The landing, he actually landed pretty flat-footed, didn't look like he was in too much discomfort. Watch him step back. It's this step back where you'll see, that's it. Like he grabs his foot and his left calf and he's done. Now, immediately when I saw this play, I was thinking, okay, if he had pain with maybe explosive jumping or the landing, I'd be more concerned of an Achilles tendon tear. But looking at just the step back causing this tear, not typical for a tear that requires so much force. A lot of people will report that they rupture their Achilles tendon after they jump or they stretch their tendon in an extreme fashion. And I'll show you the actual anatomy before we get into it a bit more. So this is the left leg here. And this is what we're looking from behind. So this is your middle side of the left leg. This is your outside of the left leg. And your calf is made out of a series of 3 muscles. So we have our medial and lateral gastrocs. We have our soleus, and there's actually a little guy called the plantaris, and I believe it's this guy here that will go underneath. Doesn't have too much of a function, but it's really 3 muscles that make up the calf. These 3 muscles come together and form something called the Achilles tendon. So this Achilles tendon is a very strong fibrous structure that attaches our calf muscles to the heel. Our calves are responsible for us being able to toe down our foot. So basically jumping or lifting off our foot and providing us with torque as we're walking. So extremely important. Now, calf issues tend to come on when the load of the tendon is outweighed by the amount of force we're putting on it. So there are 2 kind of instances where like Achilles tendon ruptures or calf strains happen. And essentially it's when you either put so much force on this tendon system, so you go down to jump, you contract your Achilles tendon right here, but you put so much force that the contraction essentially rips the actual tendon and causes a tear. The second and more common way I see these calf injuries occur is when the foot is flat and the calf goes into a stretch. So imagine a calf stretch against the door. You're really putting stretch on this Achilles tendon. This foot is tilting upwards instead of pressing down, and it puts this in an enormous amount of stretch. And that's where typically you'll see the tears and the strains. Now I want you to go back to this area here. And I want to show you the mechanism that I was suspicious of. So Marcus steps back, and look at how his foot comes down. It's almost like he's doing an Achilles calf stretch. That's it. Heel down, and look at the amount of, we call it dorsiflexion, but look at his ankle flexion angle. It's extremely high, and one where I was suspicious, where I'm like, okay, it's either an Achilles tendon rupture or a calf strain. To be honest, with the force he stepped back, it didn't seem plausible enough to be an Achilles tendon rupture, but I mean, I've seen it all. Some of the risk factors for something like a tendon rupture are, yes, the activity you do, but have you had steroid in the area? Because steroid, for example, will weaken tendons. Another one that I've seen quite a lot in clinic, believe it or not, is fluoroquinolone antibiotics. So things that you'll get for kidney infections and for bladder infections like ciprofloxacin. I have seen patients take those antibiotics and rupture their Achilles tendon in the subsequent weeks. So it definitely happens. And I mean the other risk factor is a prior calf issue, calf strain, or a prior Achilles tendon rupture. So these are things to consider, not in Marcus's case, but kind of in a patient-by-patient basis. I wanted to show you this play in a bit more zoomed-in fashion. So if you look at Marcus's calf, I want you to pay attention to this medial area. I'm going to play it on full speed because you'll be able to appreciate a little pop that you'll see. And it's right there. So that pop will be right here. It's very subtle, but it's definitely there, especially when you watch it on full play. That's the pop right there. And unfortunately, Kevin Durant had a very similar injury, or very similar looking like injury, which was diagnosed as an Achilles tendon rupture that took him out for the season. And I want to show you that one more time. So this was Durant's injury. And just take it in, you'll see it right here. And that's the pop. Now, I mean, the amplitude of that pop was a lot higher than this one. So Marcus Smart had an MRI this morning, and thankfully, an Achilles tendon rupture was ruled out. It was actually seen to that he had a grade 1 calf strain and will be back in approximately 1 to 3 week timeline. So when it comes to a calf strain, what's the difference between an Achilles tendon rupture and a calf strain? And that's a good question. So an Achilles tendon rupture is a rupture of this tendon that essentially is the amalgamation of all three of those calf muscles coming together to insert on the heel. They tend to take someone out for longer, they're season ending, and most of them in professional athletes will require surgical repair and extensive rehabilitation. Think 6 months at least before return to play. A calf strain is essentially either a micro tear, a partial tear, or a full tear of an actual muscle. So the calf consists of 3 main muscles, and you have your gastrix muscle, which is your medial and lateral, you have your soleus, and you have your plantaris. We're going to ignore the plantaris because it's a pretty small muscle, and we're not really worried about it. The other two are the more important. Now, a calf strain can be graded in a multitude of ways. You have grade 1, grade 2, and grade 3. Now, like I spoke about in a previous video, a grade 1 strain is, think about it as maybe 5 to 10% of the muscle fibers have been ripped. So a good part of your muscle is still intact. And you'll see that right here. So this area here had a bit of a strain. You'll see there's some micro tearing here. But for the most part, the muscle is okay. And in Marcus's case, this is what he had. Grade 1 injuries tend to heal in kind of 1 to 3 weeks. And essentially, you take them out, you get the swelling down, and then you have him stretch and gradually load that area slowly. So he will have trainers kind of taking him through a specific protocol. So until he's pain-free, then he starts to look at the range of motion, then he starts to strengthen it a bit, and then goes back to explosive movements. The key with not progressing too quickly is that you don't want to make this tear a grade 3 tear. Now, a grade 2 tear is 50% of the fibers or more, so you can see here. So they will take you out for a longer period of time. And a grade 3 tear is full rupture of the actual muscle, in which case you may either need to surgically repair it in the case of a lot of professional athletes, or you can treat it conservatively if you're not a professional athlete. But in Marcus's case, he was stuck with a grade 1 tear. Now, it doesn't actually identify exactly what calf muscle had the grade 1 strain, but if we go by kind of the most common and that bulge that we saw on video, the medial gastrix is the most commonly torn calf muscle. And when we looked at the video, so this was the way Marcus's leg looked at the video, and we saw that pop around this area. So it could still very well have been the soleus or the medial gastrix. I can't say for sure because we don't actually know which muscle was identified on the MRI. We were just told it was a calf strain. So grade 1 tears, much like the one Marcus had, will take you out for approximately 1 to 3 weeks. And honestly, best case scenario for the Boston Celtics in this case, he will be back. It is not season ending. Grade 2 tears take you out for about a month to 2 months. The rehabilitation is longer and the risk of rupturing the full muscle is higher. And grade 3 tears, think about them like Achilles tendon ruptures. They take you out for approximately 6 months, likely will need surgical repair. But good news is that this was just a very mild calf strain for Marcus Smart. One last thing I wanted to mention is many people were worried that Marcus Smart had actually popped and ruptured his Achilles tendon mainly because he had immediate pain. We saw a bulge on replay footage, and likely there was an audible pop. Now, believe it or not, a calf strain can also present in a very similar way. As a doctor, the way we approach things is prepare for the worst, but hope for the best. So in this case, they treated it like a potential Achilles tendon rupture, really got him off of it, had the imaging, and thankfully he was a grade 1 strain. But that's just the way we approach things in medicine, because we don't want to miss the big and bad things that will provide a big debilitation for our patients. All in all, Marcus Smart escaped with probably the best case scenario injury, considering the mechanism that we reviewed and other potential complications of the injury he sustained. He will likely be back by February, playing as strong as ever. If you like this video, please like and subscribe to my channel. If you have any questions or comments, leave them down below. For now, that's all.